Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life in Balance. And today we're going to talk about something that unfortunately is usually not brought up by oncologists when talking with their cancer patients. And that is lifestyle changes that have a dramatic impact on outcomes. I think this is my own personal opinion, but I think the general idea in oncology is that whatever we're going to do to you with chemotherapy and surgery and radiation is more powerful than anything else. So if you want to do something else, you can, but that's not really the big player, and we're going to continue to do what we do. I could not stress that this is further from the truth. We have seen study after study after study on certain lifestyle choices having to do with better outcomes in most types of cancer. Things like exercise and prostate cancer, and in this particular case with breast cancer, and long-term outcomes with dietary choices, and some specific ones. So in particular, this study looked at almost 9,000, so 8,932 women who had been diagnosed with breast cancer, and they followed them for the course of about 10 years. And ultimately, 12% of that population did die of breast cancer. There was another good chunk of people that died from other reasons within that 10-year time frame. But one of the things that they looked at was what's called the dietary glycemic index and glycemic load. And this has everything to do with how fast the food you eat turns into sugar in your bloodstream. And that is regardless of whether you want to prevent breast cancer, or survive breast cancer, or heart disease, or diabetes, or anything. Stopping our intake of all these crappy carbohydrates is critical. So it should come as no surprise that those people who had a lower glycemic load to their diet, in other words, they were not eating sodas and chips and crappy bread, they were eating complex carbohydrates and beans and vegetables and healthy fats and healthy proteins. They had a 33% lower chance of dying from breast cancer. Overall, big picture, they had a 26% lower chance of dying, period, if they had a lower glycemic index. This shouldn't come as a surprise. I already said that. But in society, we eat way too many foods that hit our bloodstream as sugar in a rush. And that's never a good thing. So making our dietary choices, sticking with whole grains, so that means no enriched wheat flour, no high fructose corn syrup, no sugar, and trying to get to our complex carbohydrates, so true whole grains, so it can't say enriched wheat flour on the label, and no high fructose corn syrup. Those kinds of grains and foods are going to be good for us, and they're going to help us fight off most every cancer, in this particular case, breast cancer in particular. To add to that list, things like exercise, higher quality fats, more of a plant-based diet, so not necessarily vegetarian or vegan, but definitely towards the end of pescatarian, so a fish-based, or less animal proteins. I generally recommend people stick with about 20% or less of their animal proteins during the day, which is really not that hard to do. I know for me with breakfast, I don't have any animal products. A lot of times my lunches don't have animal products, so I'm not having any animal products till dinner. So that type of an idea, concept, can lower risk. I already mentioned exercise, sunlight exposure, avoiding environmental chemicals like BPA and phthalates, which I've covered in other videos. The bottom line is the choices that you make will absolutely, without a doubt, be one of the major players on whether or not you survive long-term from breast cancer. As always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.